Hi. Oh, I
Hello,
think, oh,
Sarah.
yeah, I
Hi.
think we're recording. So, hi,
Yeah.
Louise.
Hi.
We're here literally just have a conversation, and I just want to introduce Louise, who is the guest today. Louise, just share who you are, please.
Okay, my name is Louise Baker, and I hold a master's degree in neuroscience and psychology of mental health. And I have over 20 to 30 years experience working with people in hypnosis, working with people coaching. I have a body of commercial experience as well, but predominantly I've worked in clinics that I've created myself in the Hertfordshire area. I've also worked in Harley Street in the Wren Clinic, but mostly now I do work with Brains Trust, which is a brain tumour charity. And I also do a degree of work, of advisory work, and looking after well-being for an organisation called Made for Life Organics. So that's kind of what I'm up to these days. I've also published. So I'll do a little plug for myself.
Yeah, please do. Yeah.
There we go. So when I talk about the neuroscience of stress and stressors, I've actually just published a chapter in this, what is now a global bestseller, called
Yeah.
And
that was initiated. That was Joan Scott's one, wasn't it?
Joan Scott's one, yeah. So all these names are very familiar to a lot of the people who might catch this this recording. So yeah, Joan and Andrew Priestley, and
Okay,
there's lots of folks in that book. And my story is about is a story rather than do the I'm going to tell you a low situation that I recovered from. I went with something a little bit more generic, which was to help people understand how to recover from a point where they're in paralysis. Whatever might be causing that paralysis, the story is still relevant, whether it's a work-related thing, a life-related thing, and it brings together all those things I love to talk about, which is psychosensory work, which is basically looking at your senses, and not only these senses we know about, that sight, smell, taste, touch, hear, but also those internal senses of interoception, proprioception. Interoception, how the mind makes sense of the messages from the body internally, and then proprioception, where I am in the world. Am I upside down, or am I standing on my two feet? So we don't touch much on vestibular perception, even though now the science is starting to separate it out and say it's quite a different sense. So it's quite interesting. So there's a lot in that chapter. So, but we can cover off some little pieces in there in a minute. So that'd be great.
exactly.
That's what I'm doing these days.
Well, we've had some very interesting conversations over the last few months, haven't we? So we just thought we'd bring a conversation to this, because I just think, there is so much interesting stuff here. And I know that you obviously support and coach people. Obviously I support and coach people going through a cancer journey. You obviously, you got the neuroscience background, which is absolutely phenomenal. And obviously, your sort of passion is around sort of brain tumors and other things around that, isn't it? So that's where your predominant piece of work, I believe, is.
Yes, that's right. So it's a really interesting story that's gone many circles, because when I first became a hypnotherapist, one of the very first people I treated was a young man called I can't call him Glenn, a young man called Glenn. And Glenn walked into my room, and he had a hoodie on, and he had earphones on, and he sat down, and he took everything off, and I could see he had a shaven head. And he said, I've got a brain tumor. There's no coming back from it. He says, but what I really want to do is be able to travel on public transport. Now, this is a theme, by the way, for people with brain tumors, and that is due to the fact that they tend to develop a pattern of epilepsy. It can be managed, but it doesn't stop that fear of having an epileptic fit in public. And so there's a lot of unraveling to be done in the therapeutic environment. And what I did with this young man was I had to think on my feet, because as a hypnotherapist, and this is so relatable to the industry, I was told I mustn't treat people who have epilepsy. So what do you do when someone walks in your room? And this is, I know, a problem that so many therapists have faced, but don't need to face anymore, because there are protocols, and I'm sure you can tell us about what you've just trained in, that allow you to do that work. But I just thought, well, I can't do any harm if I just talk to the chap and work out a treatment plan with him and explain the situation. But by the time I'd talked to him, it'd gone out the window, and I was on a different journey to understand why hypnotherapy and why I wasn't supposed to treat people with epilepsy. Couldn't find any evidence anywhere that I couldn't, not a shred of it. Phoned up my insurance company, and they went, no, there's no reason why we don't think you should treat anybody with epilepsy. Oh, okay then. So bang. Just a reminder that so much of what we're told about what we can and we can't do, which is a really powerful message, isn't it? Like, is rubbish, utter rubbish.
Yeah. And it's often because of the insurance companies, actually. So if your insurance company is giving you the go ahead, it's often the fear that, you know, being sued or whatever and doing the wrong thing and blah, 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 blah. And that actually excludes so many people from actually seeking treatment, because they feel that they're actually going to be excluded. You know,
Yeah.
And the same with people generally with cancer. You know, obviously, yeah, we can talk about touch therapy and massage as we go through, but you know, my understanding is 96% of people get turned away from salons and spas because they're told that they can't have a massage because they've got cancer. So, and that's actually, you know, there's no evidence. Again, there's no evidence with these things that's going to actually bring on cancer further by having a massage. So it sounds like, you know, a really similar thing. Why can't you treat somebody with epilepsy, you know, just because who says we can't?
Well, that story, and that's not just a story, it's a real thing that happened to me. And eventually I got invited to a charity event raising money in his name. I didn't realize he did 6 sessions with me, and I was greeted with open arms and by a girlfriend who said to me, oh, I can't thank you enough. You gave him his life back. You gave him the ability to go on a bus, to travel around London, to do things that he wanted to do. And that actually sums up exactly why we both do the work we do, because we know that it's so easy to get caught into a like a jar of the making of your brain and your nervous system that keeps you stuck in a place, when we know, and me as an applied neuroscience specialist, I know that you can change, and you can change in a variety of different ways that are quite remarkable. And there are lots of things that I love to do now. I have to be I work in groups mainly, so of course I can't get focused into detailed areas of trauma, of diagnosis, but I'd be really interested in hearing from you how you would guide your people through, because I can't do that very much in a group, because I have a duty of care to everybody in the group. And if somebody gets really finds it difficult to manage their feelings around that, then I've opened that up and I can't manage it. So we hold the group in a different space, which is where one-to-one working and coaching is just so powerful.
Yeah, it really is, actually. And I've looked at group, and it's something I think I might get into further down the line. And I'm actually looking at setting up some retreats as well. So my signature retreats where I can take somebody and hold their space. But I don't want to do that purely in groups either, you know, for that reason, because I want to be able to somebody to be able to release their trauma as well. You know, I want somebody to be able to speak openly, and I also don't want to actually. What I've found sometimes with my clients as well is that they can get fearful of other people's stories as well. Do you know what I mean? Because people bring their stories into the mix. So, you know, for example, I had a client who came to me very upset. She'd been to a Macmillan group thing. It was all meant to be a positive thing around ovarian cancer. And she messaged me later that day going, Sarah, you know, I went to this group and I'm now really sitting in so much fear because they're talking about they had reoccurrence and they had, you know, and this has happened and this treatment's been awful and she said, and now I feel like I'm back up, you know. So where we'd done a lot of work to reset her nervous system, to bring her back down into calm, one meeting that was completely undone. It was just out the window. So, you know, for her, I'm not saying that doesn't work for lots of people, but for her, group work in that situation, which was meant to be a supportive environment, actually didn't end up being a supportive environment for her. But yeah, one-to-one, well, I purely love the journey of it, you know, the nurturing of it, the fact that people can release, the fact that they can share their emotions really easily, the fact that I can hold that safe space for them, you know, to actually release their emotions and share it very openly and honestly, which actually, you know, and that's so healing in itself, to actually have somebody just not judge them for those feelings or anything else, you know, and just say, it's okay, I've got you. It's like holding that, you know, holding and nurturing them, and actually just allowing them to come out with it. And sometimes it like, you know, it's almost like they're just bringing it all up, and then eventually they just sort of almost run out of energy with it a little bit, you know, and then they go, oh,
I feel so much lighter, they go. Because often what coaches aren't spotting what they're doing is this, the capacity to be compassionate and to move and to mirror with the client is also, and to allow, you know, like, you know, to those moments when you say, and take a breath, and take
yeah.
a breath. Yes. Take a breath while you're doing this. It shifts the nervous system, and the nervous system suddenly realizes, oh, okay, I can take a breath while I'm recounting this. And actually, I can also release, and I can also understand that in the presence of someone who's really, you know, listening to me, it's great. And these are all wonderful ways of dealing with trauma. And one of the other things that you asked me, and this is a great thing to do. I talk a lot about the neuroscience of touch, and that story that what you just accounted about in a group setting. So there are lots of different types of trauma, but the type of trauma you're talking about there is that she was vicariously traumatized again by the stories, by the words of the other person. And again, you know, as a psychosensory therapist, goes in through the ears are right up here with the brain, straight into the brain, straight into the limbic system. If the limbic system goes, wah, wah, that's it, off again, gets adrenaline. So this is the process when we're vicariously traumatized. It doesn't have to be something we see, it can be hearing. And that then kicks off the amygdala to say, oh, and other areas of energy in the brain, to kick off a load of noradrenaline, to go, oh, this is a really important memory, I mustn't forget about this. I'm going to really load this experience up into my body and into my brain as something I'll never want to do again. Will she ever want to go to a group session again? No.
No, she made that quite clear, actually, you know,
yeah.
so she won't, yeah.
So you and I, you asked me before we started recording to talk about one of the things I do, and I'm going to explain the neuroscience of it. So the neuroscience of touch, I have a pen in my hand here. Okay, the moment I have this pen in my hand, sorry, I'm just going to do this, Sarah, because I think it's really important. Yeah. Because if people know they can do this when they are in one of these group sessions, it might transform their experience, because this works. So my left hand is touching a pen, and it's noticing that that's actually one of my favorite pens, Tiffany pen, an Elsa Peretti Tiffany pen. It's one of my very favorites. It's lovely and smooth, it's beautifully designed, and I love this pen. And I've got, you know, it doesn't have to be this pen, it could be any pen, it could be a pencil, but it's got a set of sensations associated with it. I know I'm holding a pen. My brain knows I'm holding a pen. And look what I've done here. I've gone to the opposite side here, because the processing of holding that pen is processed on the opposite hemisphere. So as the messages from the mechanoreceptors and the other receptors in my fingertips notice what I'm doing, it travels up my arm and into the back here, into my spinal cord, up through the spinal cord, into the brainstem, swaps over into the thalamus, is like a sensory switching system, where things like, oh, I've got a memory of this being my favorite pen, or I've got a memory of this being my favorite colored pen. All right, whatever you choose, which is a nice memory. So if you're going to go to a meeting, take your favorite colored felt tip with you, because then you've got the sensory experience of seeing the color relaxes you as well. I'm going to take a breath. Okay, now that's going up into my brainstem in a different way, and also telling my vagal nerve that actually I'm breathing, to breathe slowly, to tell my parasympathetic nervous system to come back online, away from the stress of what's going on. Then I take it out to the side. Oh, I've got movement. Oh, I've moved it out. So there's the other sense of proprioception. Where's my hand in the world? I've moved it out to the left-hand side. It doesn't sound like a lot, but think about all of the energy it takes to process this stuff in our brain. We take it for granted. So anyway, while I'm doing this, and I bring it into the middle, and then I take it out to the side again. You might like to join in with me, Sarah, if you've got a pen.
Yeah, I can't find something now.
Oh, it doesn't need to be a pen. When I do this with Brains Trust people, we use the little brain. I really do think I'm going to get an industrial supply of these brains, because when we use touch, we're really looking after our brain as well.
I've got a hand cream.
hand cream's perfect. Sorry, I dropped my brain focus. I'm coming back. Here we go. So, because normally what I do, so it doesn't really matter what you are. So even if you're anywhere you are, it's just the process of recognizing, and you might have some meaning about hand cream, about how it keeps your hands safe because you do a lot of massage, how you have to self-care to look after you. How all the times you've massaged, all the times you've done a lovely treatment, it might bring back nice memories like that. Or your brain is just going to go, yeah, I like this. I like the idea I'm holding my hand cream to help me self-care. And we just do this, and we take a breath. Now, while all of that processing is going on, with the best will in the world, the person's story on the other side of the circle cannot affect you as much.
Wow.
You have multiple sets of processing, and you are putting your body into a calmer space.
It's amazing how you actually do feel calmer just by doing that. I
your
already do.
Your brain is working really hard. So that's bilateral stimulation. Right. Because, say, for example, somebody's had breast cancer, then actually that movement might be really tricky for them. Make it smaller, or you can make the movement tap on either leg. It doesn't have to be that. Bilateral stimulation is bilateral stimulation. It's using the power of touch and sensing on opposite hemispheres of your brain in a rhythmic way to change what's going on in your head. So you can start, and maybe every group session should start with the warning, and should start with and here's some techniques to manage while we're respecting other people's stories. We're gonna manage and self-care ourselves.
Yeah, I love that. I really, really love that. I'm gonna have to borrow that. Is that okay?
You can borrow bilateral stimulation, of course. Yes.
Thank you. I will be bringing it to my future sessions.
Because I dread to think that people might walk in, that they're becoming ultra traumatized by listening to other people's stories. And I do this at Brains Trust, and I because I'm brutally, it's not brutal, I'm over compassionate, because I know the impact the words can have on people. I say, look, guys, when you introduce yourselves, tell us about your story. And by the way, we understand that this can have an effect on you. So learn this technique while we're doing it. And then realize how you too can actually move out of your own position to allow a little space to listen with compassion, not with jumping into their trauma, but just going, yeah, I get that. Wow. Okay. I hadn't considered that this might not all go the way I want it to go. And that's hard to hear, but that's okay, because that's them, and that's them. So it gives the individual a chance to keep their frontal cortex online, to keep the coaching they may have had, to keep their own sense of self in place while listening to other people's stories.
Yeah, yeah. Wow, I just think that's absolutely immense. And, you know, thank you for sharing that tool. I just think, oh, wow. I don't know if you've been listening. Have you been listening to the conversations? There's been quite a lot of conversations, obviously, in the last couple of days after, you know, Her Royal Highness sort of came forward yesterday. And actually, it makes me feel quite emotional, funny enough. I can feel my own emotions coming in about the lack of sometimes support during and following a cancer diagnosis. You know, my area is more about during, but obviously I will take somebody all the way through, so after, you know, moving them forward afterwards as well. But I love the way that she actually mentioned as well that about, you know, how important it was for a holistic approach, that actually we need to connect with our mind, body and souls, you know, and that it's not just, you know, so it sounded like she was very much embracing this sort of like yeah, just holistic, internal, you know, really getting to know herself as part of her healing. And I think, yeah, and it was a very, very powerful story that she shared.
Yeah, it moved me enormously, and it was very necessary to have said. And I think that it's also really important. And I'm going to bring a little other equation into this. And that is that, and particularly for women, but not just for women, for men as well, there's another lot of talk going on at the moment. And another piece of writing I've done has been about how we equip ourselves for aging, and how we equip ourselves for the shifts, the psychological shifts that happen when we age. Well, those psychological shifts, there's a lot of evidence about what happens to people when they age, but actually nobody, you know, everybody knows that there is a psychological impact, but they just call it trauma. But I want to talk about scaffolding within the brain that starts to change when people have powerful medications, when people have operations, when they have anesthesia, when they have radiation therapy. I mean, this creates a lot of debris in the brain that needs to be processed, and that processing needs to happen through great sleep, through great hydration. Well, I mean, Sarah, you know this, great hydration, and massage helps enormously. Actually gently massaging the face is an enormous benefit to people who've had treatment, because it helps the cerebral fluid that is within the brain structure to do its job in terms of cleansing and moving through the body while the brain produces more fluids. So all of this, you know, people don't realize there are these reservoirs of fluid in the brain. The brain sits in fluid. We must look after it, because it is the way the brain cleans itself up. So there's none of this, you know, no matter how tempted we are to have that extra glass of wine because we're so fed up if we're doing treatment, but that's going to dehydrate you, which ultimately dehydrates your brain. I know I'm preaching to the converted with you, but I look at it from the neuroscience perspective, and I go, just think that detritus has less opportunity to clear itself out if you have a dehydrated brain.
Yeah, yeah. I gave up drinking, funny enough. I used to dehydrate myself a load through drinking. But no, I gave up a couple of years ago. I have the odd glass of wine every now and then, you know, but literally it is every now and then, and it's a small one. So, and I enjoy that when I do it. That's not a large glass of red wine you've got there, is it, Louise?
No, a large glass of hydration fluid. Because my aging brain needs the extra bits in it, and my aging limbs and muscles require a lot of help to not cramp so much.
Yeah.
So
I traveled last night, and even though, so yeah, hydration is massive, and I definitely
electrolytes and the right balance of your of those core minerals is so important. So, but we got off that, and I'm not. Oh God, I'm so far from perfect, but I do notice. But the reason I said it is because when we do all of these processes, they're going to be needing a hydrated brain. So the other way to think about it is there's this lovely story from a philosopher who talks about thinking about how the brain moves around, right? So he says he thinks about it, and he's a neuroscientist as well as a philosopher. He thinks about it like a murmuration. You know how the birds, well, you're down in Hove and Brighton, you know how the birds do their wonderful turning, and actually there's moments when you see it's almost like they disappear and then they appear somewhere else, all of them. So the brain is that they're all still there, but he likens that to the way certain networks in our brain work, and that they're always kind of working, but then the moment you switch the attention to a place, then there's more activity in that place. If there's more going on in one place, there's less going on in another. It's like a thing that happens. And I think that's really useful. And I would say, remember to keep your brain hydrated. So when you want your brain to move away from focus on one thing, you've given it every chance. That every piece of great advice you've ever heard that you've done in therapy or in coaching, if you look after your brain, it gives you more chance for you to be able to make that switch from being ultra focused in an area called your default mode network, which is where you're telling yourself you're stuck and you get stuck in there and you can't move, back to I don't want be stuck in there. I want to do something more pleasurable. I want to move into thinking about what I like doing, going to listen to a piece of music, or I'm going to listen to a piece of music and jump around now because I'm stuck. So keeping the brain hydrated, keeping the brain moving, and knowing that you can move. Even this is why this is a lovely one. So that's going back to a person who's stuck in a group session and not knowing what to do. Is stuck in a situation where she didn't believe she had the power to move. You don't need to move your whole body. You could just move a little bit of your body and you're moving. It's a form of escape. No one said you can't do that. No one said you had to listen intently and be impacted. So by someone else's story. Other people do that.
And sometimes it's remembering that's, and it's that word story, isn't it? They are literally stories, and obviously that they are very personal, not to negating somebody's very personal story, but they are stories and they can sometimes be looked at in different ways. And, I'm not taking away the very clear trauma what people get when they're facing a diagnosis. Really, really do, and and they do feel very stuck in that story. But it's just trying to bring again some peace to the chaos of all that, and how they can face that with just a calmer approach. So my words probably aren't really, coming out very well. But
I would say, think about the birds, the fluidity of a murmuration, how I'm stuck, how I'm here, and then how do I move to over there where I go and put Gloria Gaynor on and jump around the kitchen if I feel like doing that, and put the kettle on at the same time. But sometimes the physical stuckness that somebody might feel when they're there is both a real somatic feeling and a psychological feeling. So this is where something like a bilateral stimulation, just to get them, just to do a little bit of a movement, or even a little EFT tapping, just something, or a shake.
Well, that's somatic release as well, isn't it? Shaking, moving, and all of that. And it's having this toolbox of tools. I think that's what I was trying to say earlier. It's having the toolbox of tools, I guess, which you just shared some amazing ones that people can move forward with, so that they can actually come to that place of peace and calm, and releasing their emotions. And as you say, putting on the piece of music. And actually there's so much stuff around music being, you know, can change our mood, and you know, and obviously there's even stuff around sound healing now, you know, and the frequencies and other stuff. So it's finding your way, I guess, you know, of your own toolbox and what works for you, because what works for one person might not work for another person, and that's where individual approaches are really, really useful.
Yeah, and I think that you've hit another really important nail on the head, and I say this all the time. So yeah, there are evidence-based treatment profiles, and yeah, there are lots of people out there talking about this thing called somatic healing, and talking about psychotherapy or inner child work, or this, or doing some creative visualization, or what Joe Dispenza's doing, or what, you know, the body holds the score. There's so much out there that it must be very, very confusing. And one of the reasons why people want to pull back to go, well, the NHS says maybe I should do some CBT. Well, yes, by all means do that, and by all means do everything till you find the thing that empowers you to feel differently, because you're the only person in this equation that really matters. And you know what? Your brain might go, I really love doing that now. And in 4 weeks' time, it might say, oh, I'm a bit bored of that. Can we have something novel again? And that's what I was going to say about the other challenge that we have as people who are working with people who have cancer, is that cancer is no differentiator to people who have neurodiversity. It doesn't care whether you have autism, ADHD, dyslexia, or any other type of mental health challenge going on, or a severe mental health diagnosis. It doesn't care. But the scaffolding shift that can happen for people who are in those brackets may be even greater. And we all know there's, that person seems to be fine. You know, they've worked out what they're doing and off they are. They're managing their journey. Well, what about the groups of people that have masked in life so toughly how they manage that journey, how they manage their life, how they hold everything together just because of their diversity or because of what they've been masking? Then I really feel for those individuals, and I feel for those individuals the same as when they age and then they get to retirement and they have to move through something that they've held together with sticky place and sticky tape and plaster and done really well at it. And I think sometimes those individuals we have to really look for. And if someone like Kate, who you don't feel is held together with sticky tape and plaster, also says my scaffolding's fallen apart when I got this diagnosis, and I've got, you know, she's kind of saying, and I know I'm pretty strong. So how do the folks who mask and have other challenges going on in their lives cope?
Yeah, exactly. It was interesting. I didn't actually hear the interview, and I must see if I can hear it. But there's somebody apparently on, I must have been the radio. A friend of mine was telling me she was from the cancer research, and she was saying, "Oh well, it's all well and good, but not everyone needs that." And actually, that enters into this conversation, I think, really nicely, because maybe not everyone does, but it's not a one-size-fits-all approach, is it? You know, so everyone will probably need some level of support, because we're human beings, and that's part of our you know our need almost to feel safe, isn't it? You know, that comes back to our need to feel safe. So, you know, and when facing a diagnosis, how many people are going to be sitting in it feeling safe? I don't think anybody would be. So, no. You know, ultimately, but the support, as we just mentioned, will look different for different people.
Always look different.
You know? Yeah, exactly. So it's not to say that they won't. And you know, I'm sure Kate's support and what she had was probably very different from what I had, and what, you know, somebody else had up the road, or what my client was talking about, you know, whatever, you know. Everyone's support looks different, and it's just, as I say, it's just not that one size fits all approach. And as you rightly mentioned, you know, the fact that, you know, we're going to find different tools and dip into different things. I mean, I love Joe Dispenza, for example, but I dip in and out of Joe Dispenza probably for the same reason. I might get a little bit bored and I'll move on to something else, and then I might come back to Joe Dispenza. And there's so many different, so many different things, and and I'm still experimenting and finding my tools.
I always, so I do, when I'm working with my clients in Brains Trust, we start with small meditation. Start with this concept of being in a place that's okay, because the word safe can be too challenging at times. So we start with an okay place, a place you like to be in, and then people start to realize from somebody who's very athletic but can't do any running or swimming, this individual she went into a place she loves to be, is hiking up a mountain, and she just went, wow, I got all the I got to feel like I like to feel hiking up a mountain because of the memory. Wow. And I said, yes, you've got it. But now we build on that, because as you start to realize you can hold your attention, and this is another aspect of the work we do, is particularly for people who are having, I do a lot of work with scan anxiety, and procedures, and obviously in radiation therapy there is a pressure on everybody to stay very still while they're having their therapy. And in brain tumors, the individuals actually wear masks, so people with secondary cancers are likely to have this experience of literally being bolted down while the radiation therapy is going on. And I know, I can see your face, you're shocked by that. That takes a lot of skill to hold your state. And so that is one of the things I teach. And that is one of the things I think that Joe Dispenza indirectly teaches. He teaches people how to hold state over long periods of time in their meditations. Because if you can learn to do that, you can take on anything anyone throws at you.
Yeah, absolutely. Yeah, and it's having he talked about the elevated emotion with it, so it's not just a feeling, it's actually having the emotion to go alongside it. So it's quite a big visualization, and I use visualization a lot within my practice, and taking people on a journey, through sort of like a meditative visual experience. And I think, as you just mentioned, that can be a really, really powerful thing. And I think, people get a bit hung up on visualize. I can't visualize. But, some people I think probably can visualize more. I wouldn't say mine are really, really powerful, sort of like IMAX, sort of like visual things. But I can still picture walking along a path, for example. I can still picture being in a forest. If you can picture yourself eating an apple, I think, you can visualize, can't you? It's I think people get very hung up on that they can't always visualize.
Well, I think that some people can't. There is a condition called aphantasia where they don't form images. So, but a lovely way of working with that is instead, if somebody says to you, I really just don't have an image, that's fine, because you know what it looks like. You have a knowing what a mountaintop looks like, even if you can't conjure it up into your head. You have a knowing of what the beach is like. So allow yourself to be with the knowing. Now, it's a very interesting thing, because there are degrees of this condition, but sometimes when people start to relax, it's true. And as a hypnotherapist, I also know it's true that when you suggest that somebody's ability to be able to connect to either their visualization or their knowing in their imagination, it works very well. So I would encourage people to think of it that way. If they're listening, I can't visualize, so I might as well not bother meditating. Well, no, don't worry about it in that way. Think about it as a knowing.
I love that.
Yeah, all right. So that's a really great way to help people move through that phase of not being sure. And also for therapists, if there's any therapists or practitioners here, it's really useful, because then you're never in the crosshairs with your client trying to say, oh, you must be able to see something, when they're going, nothing, it's black. Great, then enjoy the Enjoy,
Yeah.
enjoy the velvety darkness of your own inner world.
Yeah. Love it. I think that's just amazing.
Maybe you'll get some twinkly lights as a prize, because it's very easy to go from knowing what your inner world, if it's very dark and you don't see much, to knowing what a nighttime sky with twinkly lights looks like.
Yeah, yeah, well, that's really powerful. Thank you for sharing that. That's
okay.
yeah.
That's okay.
Yeah.
For everybody, because there are people who don't do it and I'm one of those people that doesn't visualize very well, and I spend my life helping people to just access their inner world through what senses are available to them, and one of those senses is just a knowing.
Yeah,
What it feels like to feel hot inside. Well, some people don't, funnily enough, because, well, it's not funny, because they don't have an internal thermostat. So we're all so different. We're
Well, this conversation is absolutely fascinating, and I'm sure we could talk about it for probably like 2, 3, 4 hours, because I just think you're immensely interesting, Louise. You really are.
Well, thank you, Sarah, and look forward to meeting you. We can do a plug for SpaFest and seeing you again.
Yes, exactly.
SpaFest, because I know that you're working there, and also you're doing something on the 3rd day as well for the big tea and therapy. Are you doing?
I believe so. Yeah, I believe I'm doing some sort of talk. I need to clarify exactly what that is, and what that's going to look like. But yeah, and I'm on some sort of panel at SpaFest itself as well. So that's going to be useful, hopefully, for everybody.
And I'm going to be talking about really what we've been talking about today: the power of touch, the connection that's made with compassionate conversation, why we connect, how we make connection more powerful, how we look after ourselves in that connection, because I think that's really important in the well-being industry. Is that it's like, almost like you have permission to put on a different set of gloves when you're working with your clients, and to allow your body and your mind and your soul to be in a space that you're not taking on too much. It's really important, because otherwise people will run out of energy to do the work.
Well, thank you again for coming on with me today, and sharing massive insights. And I think we're going to have you on again, and we're going to have to have another conversation at some point. Yeah,
whenever you want to stop recording, I'll
do that in a minute. But yeah, that's great. Thank you.
All right.
And take care.
Bye.